Peace be upon you and God's mercy and blessings. Doctor, what exactly is the seventh nerve? And can there be a problem with the seventh nerve due to ear issues? Yes, of course, the seventh nerve is the nerve that moves the face. It moves the eyebrows, raises them up, closes the eye, allows us to press on food while chewing, and moves the corner of the mouth. So of course, if there's a problem with it, all these muscles stop working, and that entire side of the face doesn't move. The eyebrow doesn't lift, and the eye doesn't close properly. And when a person speaks, they feel that their mouth is not aligned, being pulled more towards the healthy side, and they might have difficulty swallowing, with food gathering in their mouth, unable to chew it properly. So these are the symptoms that occur when there's a problem with the nerve. Well, the seventh nerve actually runs inside the ear. It originates from the brain, travels a short distance inside the ear, and then exits below the ear here to continue and supply the facial muscles. There are diseases that cause problems related to the ear. Of course, there are many. But today I would like to talk to you about something called Bell's palsy. Bell's palsy is when someone is completely healthy. Most people say that they were exposed to drafts of air while sitting next to a window. Exposed to a strong draft of air. Caught a viral cold. Something like that. Suddenly they feel pain around the ear within 3 days. Pain around the ear like that. Then one day they wake up to find they can't close their eye and their face is crooked. This condition occurs without a reason. It could be caused by viruses or exposure to drafts of air. And until now, we don't know the cause. Well, the person gets very startled, they get scared and think they might have had a stroke or something like that. And the issue is simple. It resolves on its own in 95% of people. The nerve fully recovers, starts working again, and the face moves, everything, all right? It just requires simple treatments, including giving corticosteroids in specific doses. The doctor prescribes them, and we ensure the eye is closed during sleep to prevent ulcers. In the past, we used to do physical therapy for the facial muscles until the nerve started working. But now, even the recommendation is enough. Corticosteroids along with eye treatments like eye drops and ointments and things like that to prevent eye ulcers due to it being open all night. The treatment continues for 2 weeks. And hopefully, within a month, more than 90% of people will have their nerve functioning well again without any issues. So when should we be concerned about this issue? We should be concerned if the nerve remains completely paralyzed with no slight movement and there is no improvement after more than 2 weeks. At that point, we consult neurologists and might perform MRI scans and similar procedures to ensure that nothing is pressing on the nerve itself. However, if the weakness and paralysis in the nerve are not complete or are improving within 2 weeks, there is no problem with that. It heals on its own, with more than 100% recovery, and wishing you 1,000 million times good health. If you like these videos, give us a like and subscribe to the channel so we know you're waiting for new videos from us, and wishing you 1,000 million times good health.